first thing, basically for all lasers, there's a few things you have to remember. Each laser has its own wavelength. So it has its own wavelength, also has its own glasses that go with it. Okay? Some of these lasers, especially this little fellow, actually has two different lasers built into it. So you always have, again, you always have to make sure you're checking the wavelength either on the handpiece or usually on the back of the laser. It'll have wavelengths listed on the back of the laser. Okay? Each one of these lasers will be marked off separately. Each laser has its own specific purpose. This YAG laser here is used basically for glaucoma surgery. Just pokes little holes to allow fluid to drain from the middle of the eye, middle chamber to the anterior chamber. And number one. This is a dermatology laser. It is used for the main purpose of this is vascular lesions, port wine stains especially, things like that. This other fellow here has a couple of different features to it. It has a YAG laser, and it also has an Alexandrite laser. The Alexandrite laser is basically used for hair removal. And the other YAG is used for non-vascular lesions. Okay. The other lasers that we use, there's a Holmium laser that we use for kidney stones that is brought in by an outside rep. We have a carbon dioxide laser, which is brought in by an outside rep usually. But we do have an old style carbon dioxide laser in storage way in the back that I've used twice since I've been here. So I don't think you're going to be seeing that one. If you happen to see it, God help us. Okay. All right. Now, the things you have to remember for all lasers, with the exception of a carbon dioxide laser, is you have to have window screens up. Okay? Every laser, as I was saying, has its own wavelength. It also has its own glasses to go with the wavelength. Again, we keep all these on top of the eye card. The only difference is we have an extra basket of laser glasses, green diode laser glasses for dental that's kept in room 11. The other difference is the dermatology lasers, they're always kept with the lasers. The BB Perfecta, which this one is, there's a laser card, there's a dermatology card, and everything is kept on there. The Alexandrite laser and for the GentleMax, the laser are kept usually right on top of the laser here. So they're usually relatively easy to find. If by any chance you're looking at something and the lasers do not match what it says on the back of the laser, as far as the wavelength is concerned, you've got the wrong set of glasses. So don't even try to use it. Okay? Safety measures. Everybody in the room has to have laser glasses on. If the patient is awake, either laser-specific glasses, or we do have, in the wrong part, sorry, we have metal glasses. They look like swimmer's goggles. They can be put on the patient also. If you're doing anything around the eye, water-soluble ointment only in the eyes, because you don't want those things, anything to burst into flames on you. Tape the eye if you can. If not, wet 4x4s over top of the eyes. All right? That's the biggest thing you have to do. You will run into some people that will give you a little bit of a fudge about not wanting to wear their glasses. Insist that they wear their glasses. All right, no matter what. Okay. As far as smoke evacuation is concerned, this is a smoke evacuator. You'll notice that in all the rooms, or almost all the rooms, they have a little buffalo filter. I will say on them. Not all those things work. Half the rooms, the wires are broken on them, they don't work. Drag this thing in. We have two different ways of getting rid of laser fumes on these. Oh, here are the glasses. I know I had them somewhere.
Are those the patient glasses?
These are patient glasses, yeah. There you go. kind of cute little things. We have several sets of these actually in the dermatology laser cart also. But backing up there a little bit before I made a fool of myself. As far as smoke evacuation is concerned, we have a couple of different ways of going with things. If you're using a laser with you just have a little bit of fume you're expecting, you can put an inline filter in, just into your regular suction. Cut the suction tubing, put this in between the canister and the patient someplace. And when you get out, just make sure you don't touch any of this stuff, just throw everything out in the garbage. If you are doing anything that you're expecting a high level of fume, or you are doing a patient that has a papilloma or any other virus, you want to use this. This type of tubing is actually made to use to hook a Bovie up with. To hook a Bovie onto, but all you have to do is just cut the tubing short. As long as you're holding about 2 to 3 inches away from the side of the laser use, both of these should really suck everything right up. You should not, if you smell anything in the room at all, that means you're not getting out the fumes well enough. So I would definitely, if you're smelling anything, I'd definitely get this sucker out. And it is relatively noisy. So, I'm not going to plug it in, yes I did. And now it's going to misbehave, isn't it? I hate this thing sometimes.
Now the lights are green.
Well, the lights are green now. So why aren't we making any noise? Come on. There it goes. On and off with this. Foot pedal. So it'll basically sound like this when you just stop it. So it's pretty noisy. But it does a really nice job of clearing the vapors out. Where are we going to go next? Yeah, hold up a second here. I just have a